The following is our technique for ultrasound assessment of cam deformity. The following are our disclosures. FAI consists of a constellation of findings related to bony deformity on the femur, acetabulum, or both. On the femoral side, the alpha angle is used to both diagnose FAIS as well as determine the adequacy of cam resection. While X-ray and fluoroscopy have been the standard, ultrasound alpha angle measurement offers the advantages of sparing patients of ionizing radiation, reduced cost, and demonstrated intra and inter-rater reliability. The following presentation will demonstrate our technique for alpha angle measurement using ultrasound. Ultrasound can be used either in the clinic setting or intraoperatively to assess alpha angles. Similar to X-ray, proper positioning is essential as different amounts of flexion and rotation affect which portion of the femoral neck is seen. Here, a patient is positioned on the traction table in the operating room with the left hip extended. The ultrasound is placed perpendicular to the skin, and the ultrasound transducer is placed in the transverse oblique plane parallel to the axis of the femoral neck. This transducer position creates an image similar to the transverse oblique plane obtained by a magnetic resonance image. The image on the left shows the limb in neutral rotation, while the figure on the right shows the limb in internal rotation. Here the limb is flexed, and again ultrasound assessment is made in multiple rotational positions. One advantage of using ultrasound to measure the alpha angle is several different limb positions can be obtained expeditiously without any increased radiation to the patient. Next, ultrasound alpha angle measurement technique will be demonstrated in a right hip in a flexed and externally rotated position. First, the distalmost point of the joint capsule insertion is identified, and a tangential line to the spherical femoral head is drawn. This line approximates the central axis of the femoral neck used in radiographic measurement. Next, 3 points are placed along the visible portion of the head, with as much spread as possible to improve accuracy. Points should be placed on the concentric portion of the head to avoid erroneously including the cam deformity. These 3 points are used to form a perfect circle. Using the center of the perfect circle as the hinge point, a line parallel to the tangential line drawn earlier is drawn down the axis of the femoral neck. A line from this central point to the point where the femoral head loses sphericity is then drawn. Lastly, the alpha angle is calculated. This process is repeated for each hip position. For comparison, an alpha angle is calculated for the same right hip using a frog leg X-ray with the hip flexed and externally rotated in a similar position to the ultrasound examination. As demonstrated with the ultrasound, the same steps are taken, including placing 3 points around the concentric portion of the femoral head, allowing for placement of a perfect circle. Next, a line is drawn down the axis of the femoral neck from the center of the circle, and another line is drawn to the point the head loses sphericity. This allows for calculation of the alpha angle, which is found to be the same as the ultrasound measurement. The concept of using ultrasound to measure alpha angle is not new. Lurch et al. Reported on their technique in 2015, which demonstrated a significant reduction in alpha angles between the preoperative and postoperative states. A more recent cadaver study from our own institution demonstrated a high level of agreement between readers, further providing evidence of the efficacy of the technique and its potential role both pre- and intraoperatively.